This is what I love about us being back doing face-to-face again. So for the last 2 years, I pretty much stood in front of a computer screen and delivered my talks. This is what it's all about. 2 reasons why I got you to do it. One, I actually got you to stand up and move. What we're trying to do here is reduce our sedentary behaviour. So our long periods of sitting, we know it's actually problematic for our health, increases our risks of some types of cancers, diabetes, heart disease, osteoporosis, and the list goes on. So reducing our sedentary behaviour is one thing that can make a huge difference, okay? Really important, if you're having a not so good day, I talk a lot about good day exercise plans and not so good exercise day plans. For a not so good day, this may be a really good thing to do, is to set your timer every 20 or 30 minutes and stand up, okay? So I'm going to talk about that a little bit more later. The other reason why I got you to do it is because what we know is exercise works best in conjunction with social support. It can be hard to get started, it can be hard to get motivated and also keep motivated. So reaching out to friends, family, professional supports can make all the difference before, during and after your treatment. Keep that in mind. Today we've had lots of speakers talk about some different supports that are available. Definitely reach out and link into those, because we know that can make all the difference throughout your treatment. Can I have a show of hands who thinks that exercise can help with cancer and cancer treatment related side effects? Who thinks exercise can help? Oh, that's excellent. Who's not sure? Who's not? No? Who thinks no? Great, everyone said the right thing. So the research now is really so strong in regards to the benefits of exercise medicine, as we like to call it. In the COSA, the Clinical Oncology Society of Australia actually released a position statement in 2018 that recommended all patients with cancer should undergo an exercise program as part of routine care. Why? Much of the research around the benefits of exercise is it helps with cancer-related fatigue, one of the most biggest and debilitating side effects of treatment, physically but also emotionally. It can help to prevent the loss of muscle mass. The loss of muscle mass leads to loss of function, so us doing our everyday activities. So it's really important that we maintain that. And it can also help with things like pain and nausea. I'm going to go into more benefits of exercise in a second. Historically, the message was, whilst you're undergoing treatment, to rest. Rest is best. Now, the message is to avoid activity. And in fact, even whilst undergoing difficult regimes of treatment, we want to be able to keep a level of movement going. So we want to be able to, and yes, it may be about structured exercise, but it may be about just movement. That's where we have our exercise plan in place for a good day and a not so good day. A good day, you may walk a lap of the block. A not so good day, it may mean walking to the letterbox and back. It may be about self-care activities. It may be about setting your timer, your egg timer, for every 20 minutes for you just to stand up, go to the kitchen sink and come sit back down again. Alrighty. If we move on now to what the research tells us, the benefits of exercise. So, the big ones there, improve our muscle strength and fitness. So it can improve our heart health, it improves our muscle strength, prevents that loss of muscle mass. We know that, say for instance, during chemotherapy, we generally lose a percentage of our muscle mass. So what we're trying to do is definitely counteract that. As exercise physiologists, we do keep a bit of an eye on everybody's weight. Some people come in and they've lost, say, 2 kilos or 5 kilos, and they say, fantastic, I've been wanting to lose this weight for the last 5 years and it's finally happened. What we know is that weight loss is generally muscle mass, and that's not what we want. because if we lose our muscle mass, as I said, that then turns into everyday tasks becoming harder. Getting in and out of the car, having a shower, those types of things, everything takes more of an effort. That's where the fatigue comes into it. If we've got less muscle mass, we're having to use more energy to do a task, so we get fatigued a lot quicker. So really important, we look at muscle as gold, we want to hold on to it, and that's one of the main components of when we talk about exercise before, during and after cancer, or treatment I should say, one of the main core components is strength. Sometimes exercise is the last thing that you feel like doing. When you've got appointments, when you're feeling so tired, when you've got, not just your appointments, but you've got family life going on, you're trying to juggle work, and then we say, righto, we're going to add in some exercise now. Completely overwhelming. But what we know is that a short amount of exercise can actually boost our mood and also boost our energy levels. So a cancer diagnosis isn't a reason to stop exercise. And that's one thing that we often see, is that people get diagnosed and one of the first thing that goes is exercise. And that's one thing that we want to maintain throughout and beyond. There's benefits right through the spectrum. And two, it's never too late to start exercising. Often when I have a conversation, I have chats about the benefits of exercise, and people are, 3/4 away through their treatment, or they've just finished, and they're like, I wish I knew this, I should have been doing it. You can benefit from exercise at any point in time. It can help to prevent weight gain and help to maintain a bone density. Two side effects that are common with hormone treatment. So exercise can help counteract that, which is really important. Again, it needs to be specific targeted exercise, but any movement's good movement. It can help to improve our emotional well-being, and no doubt Charlotte might mention this in her next talk as well about some strategies, but it can certainly lift a person. It can certainly be a distraction. I look at it as self-care, so it's something that I do for myself, and for those going through treatment, it's something that you can actually choose to do. In an environment where a lot of things are out of your control, exercise is actually something that you can choose to do, to be actively involved with your treatment and feel better. And I think that's really important. And that comes through a lot with patients, that they feel that sense of, I've chosen to do this, and I'm going to continue with it. We know that it releases those feel-good hormones, and as I said, 10 minutes of exercise can boost your mood, so just 10 minutes of going for a walk can make all the difference. We know in regards to body image as well, it can have a significant impact too, just that self-esteem and self-confidence. Sleep and exercise complement each other really well. What we find is that when we exercise, we tend to doze off to sleep. We feel like going to sleep, and our sleep quality is a little bit better. If we sleep, we then actually feel like exercising when we get up in the morning. It can help to reduce lymphedema symptoms, so help that fluid movement through the body as well. It can increase chemotherapy completion rates. So people are more likely to get through a whole regime of chemotherapy without a dose reduction, ultimately getting as much as that chemo agent and the plan as possible. So that's the aim, is to try and get through as much of that as you can. Exercise can simply just help minimise the side effects, so people aren't experiencing fatigue as bad, nausea as bad, in some cases peripheral neuropathy, so they're able to actually go through and complete that whole regime, which is giving you the best chance. It can reduce hospital duration, so people are spending less time in hospital. Exercise Really, we like to, if we can do it as early as possible, fantastic, but we can use it for prehab. So in terms of if you are going in for surgery, we get in, we do some exercise, because what we do know is that exercising before, say for instance, surgery, people tend to recover a lot quicker. Yes, their hospital duration is less. They bounce back to their everyday activities and less likely to have complications post-surgery. In some cases, people exercise in the lead up to their surgery to make themselves actually eligible for surgery where they may not be. So, it has happened where, we talk about, someone's, physical ability, performance status, it may be a bit down, but we do that block of exercise to get their fitness and their strength up as much as possible, and then they're able to go through and have that surgery. The other big one, and a really fantastic reason to keep exercising, after treatment and beyond, is it can reduce the risk of recurrence and new cancers. So the recurrence, a lot of the research has been done with breast, prostate and colorectal, and it can be up to 50%, so it's quite significant. So really great reasons to keep exercising. The other thing is that we do know, I keep saying that a lot, the other thing we do know is that these side effects of treatment can actually last longer than what your treatment goes for. So exercising beyond that can help counteract that moving forward as well. So in terms of the guidelines for the Australian population are at least 150 minutes of aerobic exercise per week, moderate aerobic exercise per week. So that's 30 minutes of exercise a day. Moderate intensity, we're looking at, an increase in heart rate, body temperature. In terms of, I say, when you're walking, walk like you're running late for an appointment. That's kind of the speed that we're looking at, working up to if we can. Or you've got a dog behind you, so you are moving quite swiftly. That's what we talk about when we talk about moderate intensity exercise. The other component, core component, is 2 to 3 strength sessions per week. So body weight, dumbbells, resistance bands. You don't have to go to a gym. I like to point that out. Some people aren't gym people. That's completely okay. You can do a home exercise programs, can just be as effective. I actually gave out, we were brainstorming, I had a patient who was past TheraBands. So we got to the point where we were past TheraBands and we're looking at what can we use at home as a little bit extra weight to do a squat. Well, we came up with a nice big size pumpkin. So he was doing his squats with his pumpkin and that worked really quite well. So you can get away with not actually having to go to the gym. Which during COVID and whatnot, obviously home exercise programs were big and that worked out really well. The other main component of those guidelines is to minimise prolonged sitting, and that's where we were talking about that earlier on. So what we know is, though, some exercise is better than none. So if you're not meeting those recommendations, a little bit of exercise can bring about health benefits. But what we know for people with cancer is that it's not a one-size-fits-all approach. Those guidelines that were up just before, some people may be working up to those, some people may be exceeding those, and for some people, actually, their goals are different and those guidelines may not be appropriate. So your exercise program really needs to be individualised to you and your cancer needs. What we'll do when we meet you is talk about, and we base your program on a number of things: your diagnosis, your side effects that you're having, any previous treatment that you've had, your current physical ability, your goals, and from there we'll formulate an exercise program that will have the core components of generally your aerobic exercise, so your cardiovascular and your strength, but it may include things like range of motion, flexibility, posture, core, breathing, balance. So it's a multimodal program. The other thing that we find throughout treatment is that we can, and we've spoken about it earlier, is that roller coaster. Every day can be different. And it is about having that exercise plan in place for when we're having a not so good day and a good day. And what may be light intensity on one day, you may consider to be high intensity on another day. So you need to be flexible with your program and listen to your body. So rest is really valuable. Rest is important. Rest when you need to, move when you can. Okay? Often with the aerobic, and the tips are coming up in a second, we'll break it down. So some people might start off with 2 minutes at the start of the day, 2 minutes at the middle, 2 minutes at the end, and then we build our way up. Everybody is completely different at where they start. Everybody has a completely different program as well. So it really does need to be individual to you and your needs and changing needs. And for you to be, as I said, flexible with that, because I often do have patients, can be all or nothing. So Tracey said, I've got these 4 or 5 exercises to do, I need to do them all. No, on the day, see how you feel. You actually might do a couple of those exercises in the morning, and then, you know what, that's it for the day. You've still done something, all right? So really important throughout difficult treatments. Alrighty, some helpful tips. So seek the assistance and guidance from an exercise professional with experience in cancer, exercise in cancer. So exercise physiologist, physiotherapist, so they can guide you throughout, different treatments. It's good to have that initial assessment, get that advice, get that little bit of education, and give you the confidence to exercise, because one of the biggest things is people are not sure what to do. They're not sure what's safe to do and how I go about doing it, so people then don't do it. So please reach out. The health professionals are out there and, in Ballarat and surrounds. So I know people are probably coming not just from Ballarat, but all around today. We refer out, to everywhere really. Stawell, Ballarat, Horsham, Ararat. We've got exercise physiologists that we're referring to constantly. Start at a lower intensity and build your way up. Very important. Pace and plan, okay? Pacing yourself and listening to your body. Exercise for shorter periods of time, like I mentioned earlier, is one of the key components, and spreading that over the day, blocks over the day. It's really good to include rest periods throughout your program, and particularly when you're doing strength. We like to work big major functional muscles, and we like to make sure we have a nice rest in between those exercises, so you're fully recovered, so the quality of the next movement is good as well. Exercise when your symptoms are best. So if you really struggle with fatigue, you hit the wall after lunch, it may be in the morning that you choose to do your exercise, okay? Have a plan in place for the good days and maybe not so good days, okay, in terms of your exercise. Avoid inactivity and increase incidental exercise. We really do want to try to avoid, 2 or more days of no exercise where we can. And increasing your incidental exercise, any movement's good movement, and sneaking it in can be really helpful, and you're not knowing that you're actually doing it. So I say embrace household chores. They're actually a really good form of exercise. But, put your headphones on, listen to some music, put a podcast on, off you go. When you are talking on the phone to a friend, most of us have got mobile phones, just walk around the house. And before you know it, you've done 10 minutes, and that's adding, that all adds up at the end of the day. It all counts. When you're doing your shopping, take 1 bag of groceries in at a time, alrighty? Little things like that can make all the difference. Set meaningful goals. So this is really helpful for staying motivated. So what's your why? is there something that you're struggling with, something that you would like to be able to do? What is it that you actually want to get out of it? And revisit it, okay? So I'll just go along here. It's good to have goals, but then to actually go back and revisit it, because things might change, is completely okay. I always give out a couple of examples of some goals to just get you thinking about some different things, because I want you to be thinking about now, what's your why? What would you like to get out of exercise? Is there something at the moment that you're struggling with? And a couple, I had one participant who looked after her grandkids, but loved to play at their level on the floor. So she'd get down on the floor, she'd play with them, but her issue was then she didn't have the strength to get back up off the floor again. So that's what we functionally worked on. I see a couple of smiles there. So that's what we worked on, and that was her goal. I had another participant who really struggled with fatigue to the point where it was just a real challenge to get to appointments, to get to her, just self-care activities. It was, her fatigue was overwhelming. So when I said, okay, so we're going to start off, with a light intensity exercise program and build up, what is it that you want to be able to do? And she said, I want to be able to go out for lunch. I've been too tired to go out for lunch with a friend. So that was her goal. So twice a week after her exercise, that's what she did. She went out for lunch with her friend. So it increased her energy. She felt as though she had, the fatigue had lifted and she could go out for lunch. And so that was meaningful to her. So have a think about your why. So what's out there? BRIC offers an exercise physiology service, and that's a free service. We do individual assessments, individual programs, home exercise programs, and offer a gym. As I said, if you do live, elsewhere, we can also redirect, link you into exercise physiologists that we know around that certainly have experience in oncology. We also refer out to the community. So once we've done a burst of treatment, often we'll refer out to community-based gyms as well. So link back in, it may have been a gym that you're going to in the past, we certainly link back in. And referral closer to home, they were probably the main ones there. Chronic disease management plan, so you've got 5 sessions per year with the Medicare rebate. So that can be used for a number of different allied health services, so including exercise physiology, but as I said, there's a whole host that you can tap into. So that's actually prepared by your GP. So if you are making an appointment, let them know it's for that plan, because they like to spend a little bit extra time. But there's actually 10 sessions available for Aboriginal and Torres Strait Islander people as well. So definitely keep that in mind. Obviously private EPs around, so you've got the private, so St John of God's, they run a outpatient 8-week exercise program as well. The other thing that I'm heavily involved with is our Oncology Why Wait for Wellness information program. So that's what we call a multidisciplinary program run by clinical psychologists, dietetics and exercise physiology. And that's really promoting wellness before, during and after treatment. So that's something that's free. You can self-refer to that. In regards to referring to exercise physiology services, generally, your GP, your medical team, you can self-refer as well. So that's something to keep in mind. Finding an exercise physiologist, again, speak to your medical team. So nursing staff are fantastic, your specialist nurses, anyone in your, whether it's radiation oncologist, medical oncologist, can all be helpful there. But you can actually go on and have a look at the online directory at ESSA, So the website is up there, and you can look at different, like if you are relocating, and we have had patients relocate, and we've tapped into that and found an exercise physiologist that's going to be in their new location and link them in. So that's really nice to go state by state and see who's around, to find someone that's closest to you. Alrighty, that's a little, we always pop a little disclaimer up just about, it's particularly if you've not been exercising before, always, consult with your GP first. Alrighty, I've whipped through that.